Hey folks, how you guys doing? I was asked an interesting question on one of my videos a couple days ago, and it's about the use of oral minoxidil, and I figured I'd go ahead and just create a separate video about it because it's something I've been meaning to do for a while, because oral minoxidil is a drug I have some experience with. It's probably the most obscure treatment I've ever used, and it's also one of the more controversial treatments that's mentioned in the hair loss community. So, going over a brief history of this drug for people who don't know, it was developed in the 1960s and it goes under the trade name of LONITEN, and it was developed for the treatment of hypertension, not male pattern baldness. However, doctors noticed that patients who used it would get a very unusual side effect. It would be hair growth, not just on the hair, but all over the body. So eventually, pharmaceutical companies decided, maybe we can actually formulate this as a topical hair loss treatment. And that's how we eventually got the first FDA-approved drug known as Rogaine, aka Regain in the United Kingdom. And today it's available without a prescription in most parts of the world. So going back to its original formulation as LONITEN, it was developed as a hypertensive drug, as I said, but its use and popularity as a hypertensive drug eventually died off because pharmaceutical companies have since developed more effective and safer drugs for the treatment of hypertension, which makes LONITEN only used today for a last resort option. So that's in the case where, patients have tried other more conventional treatments like beta blockers, ACE inhibitors, statins, and they didn't work, and doctors decide that the risk of LONITEN outweigh, or the benefits of LONITEN outweigh the risks, so they'll prescribe it in that case. And as such, it is rarely prescribed, and even less so in the case of male pattern baldness. Like, I've heard of cases of some doctors in Indonesia who may prescribe it for male pattern baldness, but I would certainly not rely on a doctor to prescribe LONITEN for the case of male pattern baldness. It just almost certainly is not going to happen, and it's probably not something you'd want to do anyways, and I'm going to get into that in a moment. So, going over my own history with LONITEN, I acquired the drug on the gray market, and what I mean by that is that I got it from websites where there's some elements of legality, but it's still not fully legal. So these are online pharmacies that are still available today, and since they sell non-controlled substances, the FDA doesn't really crack down too hard on them, but what they'll do is that they'll sell you prescription medications under the assumption that you already have a prescription, but they're not actually going to check for a prescription. They're just going to say, just make sure you have your doctor's thumbs up, a doctor's prescription, and so that's how I acquired it, and I'm not going to reveal my source, of course, because I don't want my YouTube channel to get banned. And I still recommend that if you have any thoughts of considering this, make sure you talk to your doctor first. But anyways, going over my own history with it, the reason why I started taking it is that I had already been on finasteride and topical minoxidil for a good while, and I got sick of using topical minoxidil. And I realized I couldn't just stop topical minoxidil because the interesting thing about minoxidil is that it works independently from androgen-related male pattern baldness treatments like finasteride. Like finasteride, its mechanism of action is pretty well known. We know it works by going after the DHT on the scalp indirectly. It actually goes after the alpha-5 reductase enzyme, which stops the conversion of testosterone into DHT, and by blocking the DHT like that, we know that finasteride can stop male pattern baldness, or at least slow it down in a worst-case scenario. Minoxidil, on the other hand, it promotes the growth of the keratinocytes, and those are keratin-promoting cells, so it causes hair growth that's independent of other treatments, and any kind of hair growth you get from it must be maintained with minoxidil. So the first thing I tried doing is I actually tried dropping the minoxidil altogether, but I started to lose hair even though I was already on finasteride, so I knew that I had to stay on minoxidil for the rest of my life, so I figured, well, maybe something that's convenient like oral minoxidil would make adherence to this drug a little bit easier. So I decided to acquire the oral minoxidil, and I looked up some dosing information, and this comes from people online, and it was said, just try 2.5 milligrams a day or something like that, and that shouldn't be seen as an official endorsement of how much dose you should take. I mean, officially there is no approved use for male pattern baldness for this drug, but that's the dose I use, even though some people I know have used doses as much as 10 milligrams per day, and I can't even imagine that. And I used it for a period of about 6 months, and in that time, I can safely say it is the most powerful thing I have ever used. And to give you some context on that, I am somebody who has used almost everything under the sun. I have used topical flutamide, which gave me some really bad side effects and I wouldn't recommend. I have, on my research subject, used the experimentals like RU58401, CB0301. I've used alpha-tridiol, I've used minoxidil, I've used stamoxidine. I've used dutasteride, finasteride. I mean, I can, the list goes on. I've used adenosine, for instance. And out of all of those, they all pale in comparison to the type of results that I got with oral minoxidil. I maintain to this day that if you're using oral minoxidil, especially with finasteride, you will grow a lion's mane. In fact, I'd say that oral minoxidil was so powerful, I imagine that even if I weren't using finasteride, I probably still would have gotten pretty good results because it was just so powerful. I know a minoxidil, even oral minoxidil, doesn't go after the underlying cause of male pattern baldness. It doesn't attack the DHT or the androgens on your scalp in any way, but it's so goddamn powerful at growing hair, I don't think it even matters. It's just ridiculously powerful. I got a thicker scalp than I had ever had in my entire life. And in addition to that, I was getting body hair growth. I was getting longer eyelashes because, you know, you're taking it orally, so you get systemic absorption. So everywhere in the body where there's hair, I was getting increased hair growth. And that could be a desirable or undesirable thing for people depending on how much hair they want on their body. But the fact of the matter is, it absolutely worked for me. So obviously that may make the drug seem very, very appealing, and you may wonder, well, why the hell did I drop it? And the reason why I inevitably decided to drop it is because the side effects were just something I wasn't willing to play around with. Like in the case of finasteride, side effects are very rare with finasteride, but they're not the type of side effects. But even if you do get side effects with finasteride, they're not the kind of side effects that will kill you. I mean, maybe you'll have a slightly lower libido, but big deal. Just lower your consumption of finasteride, cut your dose down a little bit. Maybe do a 0.5 milligram per day as opposed to 1 milligram per day, and those side effects will go away. But in the case of oral minoxidil, we're talking about your cardiovascular health. And cardiovascular related diseases are already the biggest killer in the world. So the side effects you get from oral minoxidil are not necessarily the type of side effects you get a second chance with. I mean, if you're dead, you can't do shit anymore. I mean, so, and these side effects are not just anecdotal, they're very well documented. You can look them up. So let's go over some of the side effects. I already talked about some of the less serious side effects, such as, body hair growth of hair in unwanted places. And another one that's interesting, and this is, again, a less serious side effect, is hyperpigmentation. And I want to bring this up because a lot of people ask, like, my hair got darker when I started using minoxidil, and this can happen with topical minoxidil as well. And that actually happened to me when I started using oral minoxidil, interestingly enough. Like, I used to have blonde hair. I have an old YouTube channel, and if you look at any of those videos, I have pretty bright blonde hair. But when I started using oral minoxidil, the hair turned blonde. I mean, it went from blonde to brown. And that never changed. I mean, that side effect is permanent as far as I'm concerned. And I don't really mind because, I don't mind having darker hair. I was originally blonde, but, now it's brown. I mean, big deal. At least I have hair. That's all that really matters to me. But going over some of the more serious side effects, one of them is thrombocytopenia. And what that is that's a reduction in blood thrombocyte count. Thrombocytes are also known as platelets, and platelets are responsible for controlling internal and external hemorrhaging, so they're responsible for healing wounds both inside and outside of the body. They basically stop bleeding. So if you have like a workplace related injury or something, or if you get into a car crash and you're losing a lot of blood, then you definitely want to have a sufficient number of thrombocytes in order to stop the bleeding. You want to have platelets to stop that bleeding. So you're at an increased risk of death when you're taking something like oral minoxidil and you have thrombocytopenia. So that's just not something I want to play with. And another thing that you have to keep in mind about oral minoxidil is that it's a drug that's prescribed for high blood pressure. So what happens when somebody who has normal, healthy blood pressure starts taking it? Well, they're going to get hypotension, lower blood pressure. And if you have a really, really low blood pressure, I mean, that's not nearly as common as a problem as high blood pressure, but if you have a very, very low blood pressure, that's going to increase the risk of having like of passing out, feeling fatigue, dizziness. It can, even in extreme cases, increase the risk of sudden cardiac death. So obviously that's not something I was willing to play around with, especially since I already have a healthy blood pressure. And another big problem is that it can cause leukocytopenia. Now, the leukocytes are the white blood cells, and leukocytopenia is when you have a low white blood cell count. And white blood cells are essential for immune system functioning. So your risk of fighting off diseases and infections are going to be much lower as a result of having oral minoxidil in your system because of this side effect. And another thing that I thought was interesting is that there were some EKG alterations in people who used oral minoxidil. As many as 60% of people saw fluctuations in their T wave. And what I'm talking about is the cardiac conduction system. So those who don't know, the heart has its own electrical conduction system. That's why the heart will beat by itself even after the brain has failed. So it works independent. It doesn't work completely independently from the brain, but it has its own cardiac conduction system. And there weren't any signs that these alterations were in any way harmful, but the studies were only done on the short term. And when you think about something like cardiovascular disease or heart problems, they're usually chronic long-term problems. So just because they didn't find any short-term problems doesn't mean there aren't any long-term problems. So in light of all that information and knowledge and the fact that I just wasn't as well informed as I am today, I eventually stopped oral minoxidil. I just sucked it up and I started using topical minoxidil. And fortunately, I have found ways to make the application of minoxidil much more convenient. And I have a video tutorial about this, about how to take foam minoxidil and turn it into liquid minoxidil by applying heat and only applying it once per day. You only do need to apply it once per day because the half-life of topical minoxidil is 23 hours as opposed to LONITEN, which is more about like 7 hours, and that's where the FDA got this idea that we need to use it twice a day. It's because of the half-life of oral minoxidil, but that's not reflective of the half-life of topical minoxidil. So once a day is absolutely sufficient, and because I'm using minoxidil foam and turning it into a liquid, I have a solution that dries a lot faster, doesn't leave nearly as much dandruff, it's just much more convenient to use, so it's something I don't even think about that much anymore. It's basically just like brushing my teeth. So in the end, my summary about oral minoxidil is that even though I know there are some people who have used it and have gotten great results from it, and absolutely it is a very, very powerful treatment. It is definitely the most effective things I have ever used for male pattern baldness. It is sadly not something that I can recommend or something I would use for myself, just because when it comes to your cardiovascular health, I mean, I love my hair. I love having hair, and I never want to go bald, but I would sooner go bald before I had a fucking heart attack or I had some issue with my immune system giving out on me. And, that's why it's not prescribed even for hypertension that often anymore, because it has just too many risks associated with it. So even if you have hypertension and you're balding at the same time and you think, oh, now I can attack two birds with one stone, I still wouldn't recommend it, just because, even doctors like cardiologists will almost never prescribe LONITEN unless they have no other choice, basically, unless your life depends on it. So certainly don't interpret my success with the drug in terms of hair loss as an endorsement of it. It's not. I don't use it. I wouldn't use it again, even if I were desperate. But I just want to go ahead and share my experience with the drug because I think it is interesting and it's something that is talked about frequently. And I just want to go ahead and give my 2 cents on that. So anyways, I'm going to be back with more content soon. There's other top subjects I want to talk about, such as causes of hair loss that aren't related to male pattern baldness, because I notice a lot of people, they're losing their hair and treatments aren't working for them, and that could be because they have a rare cause of hair loss that isn't related to male pattern baldness. And since that's frequently asked about on my channel, I think a video talking about that is important to create. However, I do need to do a little bit more research, so just give me a couple days on that and I will be back with more content soon. Thanks guys for watching.